Hello everyone. Who is a good doctor? What makes someone a good doctor? Well, this video is for the general public as well as the budding doctors and all those young boys and girls who are aspiring to be a doctor. Well, let me make it very clear. I'm not saying that I have these qualities, so I am a good doctor. I'm not saying that. I'm just saying a few things which I noticed in my career as a doctor, looking at my mentors, my seniors, my colleagues, etc. There were a lot of features which I saw and I was like, wow, mujhe bhi aisa banna hai. I want to be like that. So at the same time, there were also some features in some people which I saw and I was like, nahi, mujhe aisa to nahi banna hai. This is not how a good doctor should be. So these are the few points which I feel a doctor should have. Well, it is just my opinion. At the same time, I do accept that whatever points I mention may not be practically possible in situations where a doctor is made to see hundreds of patients within a span of 1 to 2 hours. So there, even though he or she wants to be a very good doctor, it may not be possible. So there are always exceptions to every point that I say. I'm not going to talk about very superficial things like कि वो डॉक्टर ज्यादा पैसा नहीं लेता, he waives off his charges, so he's a very good doctor. No.
आप तो डॉक्टर है, इतना नहीं काम करते
पता है मैं गरीबों का इलाज मुफ्त में करता हूँ सर, इसलिए मेरा हॉस्पिटल घाटे में जाता है।
देखो ऐसे डॉक्टर हैं और तू है जो
I'm not at all talking about money. And another important factor is that the basic clinical skills or operative skills and theoretical knowledge are the absolute must. Whatever other features that I say are only add-ons. They cannot replace these basic necessities. Probably the most important quality that a good doctor should have is patience. A good doctor need to be really patient and listen to his or her patients very carefully. Unfortunately, because of the busy schedule or whatever the reason, this is something which is at times lacking. I have got a few patients who have come to me for the first time and their opening statement was, Doctor, please don't mind and listen to the entire thing I want to say, because I wanted to tell all these things but I couldn't tell it before. So being patient and listening to them carefully really goes a long way. They really want to express themselves. At the same time, it's also true that sometimes they may get diverted from the main issue and they unknowingly may start talking about a lot of irrelevant things. So it's also important that the doctor is smart enough to bring them back to the main issue without really offending them. So being patient is the most important factor in terms of listening to the patient, or if he's a surgeon, then being patient while operating is also a very important factor, because my mentor, my senior, used to always tell me that speed thrills but it also kills. So how fast you finish off the operation is not important at all, because for you it is just another day in the operation theatre, but for the patient it is probably once in a lifetime thing. So even if you take 1 or 2 hours extra, it's okay, but compromising on the quality to finish off the case fast is probably not acceptable. If you listen to the patients very carefully in the OPD, it not just helps you in making the diagnosis better, it also builds that sort of trust, and that rapport definitely becomes better, because the patient feels that yes, this doctor is sensible enough to listen to me properly and not in a hurry. He or she is willing to give his time, is spending adequate amount of time to take care of my problem. So these are all the sense of assurance that the patients get when the doctor gives them ample amount of time. Well, as I told previously, this may not be possible in a lot of settings, especially in government settings where the residents are made to see more than hundreds of patients in a span of 1 to 2 hours. It definitely may not be possible, but what I can say is as much as possible, as much as possible, patients need to be listened carefully. Empathy is also a very important quality that a good doctor should have. Well, I'm sure almost all of you have seen the movie Munaba MBBS, and there was this very famous scene from the first day of medical college where Boman Irani says, who all want to be a good doctor, and one of the girls says, I want to be a good doctor because I feel the pain of the patients and whatnot. So he says, I don't love my patients, हजारों ऑपरेशन किए इन हाथों ने, लेकिन ये कभी कांपे नहीं, लेकिन अगर मुझे अपनी बेटी के ऑपरेशन करना हो तो ये जरूर कांपेगी, एंड ऑल दोस थिंग्स. I would say this is not fully correct, this is not fully wrong also, but the truth is somewhere in the middle. It is neither black nor white, it is gray. The thing is that yes, it is far too extreme to say that I feel the pain of the patient and all these things, but it's also important that you have some amount of empathy for them. You understand that they are in pain, because there are very small practical things which we can take care to reduce the suffering of the patient. Say for example, if you're just changing the dressing of the patient, we can give half a minute extra and be gentle in removing that dressing, so that we don't give them unnecessary pain in just pulling it out in a harsh way. So that is just an example. So similarly, maybe if you are doing some procedure which is going to cause some amount of pain or discomfort, you can at least tell them that look, I'm going to do this may hurt a bit. Well, of course that may not decrease their pain, but probably they'll feel a bit better about having to undergo that. So being empathetic is definitely a very important quality to have. This is true both in case of while dealing with the patients, or as well as in dealing with the relatives of the patient. Respecting the privacy of the patient and confidentiality. See, our profession is such that a lot of patients willingly or unwillingly have to reveal a lot of things which they may not be otherwise comfortable in revealing in front of others. So it's very important that we respect their privacy, and we keep the patient related matter confidential. So of course this is known to everyone, but sometimes it is possible that we don't think of it too much and then tend to just discuss saying that today I had a patient who came with this, because by saying that we are going to reveal the date in which that patient came to us, the symptoms with which he came. So it makes it sort of evident that we are talking about a particular patient. So I think we need to be a bit more careful and respect the privacy of the patient, confidentiality related to the illness of the patient. In today's world, with the social media presence of almost everyone, probably it's also important that the patient's consent is taken before putting out a particular matter about the patient in the social media. Whether the patient comes to know about we uploading a certain thing in the social media or not is different, but it is our duty that we take the consent of the patient, make sure that he or she is okay with we posting it online. The other quality I would say is being truthful and sincere. See, our profession is such that at times a lot of things can go wrong in spite of we giving our best, we trying our 100%. So it's very important that once those complications happen, it's important that we convey to them what happened. Sometimes it may not be practical enough considering the level of understanding that the patients or the relatives have, but as much as possible, what went wrong, what could have happened, what would have happened if the treatment was not done. I think it's important that the patient or the patient's relative is aware as to what and why things happened the way they happened. And same thing goes without saying that before doing a certain procedure or before starting certain kind of treatment, it's important that we tell them about the possibilities of complications it may not be to the patient, because the patient may become too anxious to undergo treatment, but at least to the close relatives, that the possibilities of complications, or sometimes to the patient about the minor things that we can expect in the coming few days, like a small procedure where we can tell the patient that, look, it's going to hurt for next 3 to 4 days, do not worry, do not panic. So these things will again increase the trust that patients will have on the doctor who is going to treat them. Being professional, well, it's a very vague term, I would say, but as much as possible, it's always better if a doctor is neatly dressed. I do not want to define what that is, or I'm not saying that he or she should wear very expensive branded clothes. No, I just say should be neatly dressed, well presentable, I would say, and should be very careful with the words he or she uses, to make sure that the patients are not offended unnecessarily. So these are a few points which I can recall as of now. If I can recall more, I can definitely make part 2 of this video. At the same time, if any of you can help me out with this, tell me some points which you would want to see in the doctor that you are going to consult, please feel free to mention that in the comment. And if there are some budding doctors out there who are seeing this, all the best. Try to inculcate a lot of features. Again, I'm saying, I'm not boasting, I'm not saying that I have all these features. There are definitely a lot of these points which I lack to a significant extent, but yes, these are my opinion. These are the points which in my opinion will definitely make a doctor a good doctor. Thank you for watching.